Morning, everybody. Are we okay? So, really fascinating listening to Adam. So some of what I'll talk about you'll see in a very practical sense, and I'm not standing here telling you it's perfect what we've done. We've been on a journey around trying to integrate public services at a locality-based level, at a sort of population of 15 to 50,000 in different boroughs and cities across Greater Manchester. There's some huge challenges with it, not least the budget, and how you share the budget and where the benefits in terms of time saved and money saved actually fall. And we don't have all the answers to that, but I'll talk you through some of what we've been doing as our shared experience. So, the Greater Manchester context, because this is really important. So 2.7 million people, 1.14 million of those have jobs, around 93,000 businesses. The economy is bigger than Wales, bigger than the North East and bigger than Northern Ireland, so somebody from the government who was here. The money that's gone to Northern Ireland for the DUP has not gone down well in the Independent Republic of Greater Manchester. I can certainly tell you that. The financial challenge is this, that we have a public spend of 22 billion for those 2.7 million people, but actually through taxation there's only 17 billion raised, so there's a 5 billion gap. So part of what we were trying to do was to reduce that gap and become self-sufficient. When you start to get underneath that, there's some really, really worrying things about Greater Manchester, which for me is partly what drives some of the crime, and I'll show you some of the crime levels in a minute. Around about 104,000 people unemployed, well above the national average. Male life expectancy of 77 years compared to 79 in England. But when you get underneath that, if you are misfortunate to be a white male born in Salford and you look across the Manchester Ship Canal to Trafford, you will die 12 years earlier if you were born in Salford than if you were born in Trafford. That cannot be right. And so all of those things play into crime, they play into our demand. When primary school children started back in September in Greater Manchester, 11,000 of them weren't school ready. 11,000 children not school ready. And the research that's emerging around adverse childhood experiences, when you look at that, and if you're subject to physical abuse, sexual abuse, parental separation, alcohol abuse in the family, if you've got 4 of those, you're 20 more times likely to be incarcerated in your lifetime than somebody who only has 1. So all of those things are playing into the demand that policing is facing. And just, I'll pick out 1 or 2 of those, but just to sort of show you the levels of demand, because I would say crime is far too high in Greater Manchester and we need to reduce it. So calls for assistance, we get sort of 304 per 1,000 of population compared to 240 in England and Wales. Recorded crimes, and this is somewhat out of date because it's gone up significantly in terms of compliance with national crime recording standards, but 82 crimes per 1,000 of population compared with 68 in England and Wales. And over on the right-hand side, the number of organised crime groups that are mapped per million of population, 71 compared to 46. In England and Wales. Significant demand on policing services. You add to that, we get around 69 calls a day that are related to mental health issues. There's 33 mentally ill people taken to hospital every day in terms of Section 136 referrals. 33 people go missing across Greater Manchester every day. And we touched on some of the events and things that we deal with, all of which creates massive demand. And as I keep telling the succession of police ministers that we've had over the last few years, it isn't about fire collaboration. So I'll repeat that. It's not about fire collaboration. Just because it sits within the Home Office, the demand and delivering better life outcomes for our communities and reducing crime sits with local authorities, it sits with health and social care, it sits with education. And I think they're starting to listen because they're fed up of me telling them. So, how do you start to embed this into an organisation? Because you can't just bolt on an integrated way of working. It just won't work, for all the reasons that Adam pointed out about competition, about different priorities, and all of those things. So for me, it started with my own organisation, and how do we create what we call the case for change and articulate that to my colleagues, that this is what we're about. And we've got 4 really simple messages that are that case for change. And the first one is about we are there to work with others across Greater Manchester to deliver better outcomes for all of the citizens of our great city region. And that's really important to me, because if we're going to reduce crime, if we're going to deal with some of those issues that I've pointed out that we face, we have to be part of that solution and not do it in isolation. The changing nature of crime and vulnerability, I don't really need to go into that, it's been touched on, but so many of those things touch all of those different agencies that we need to work with. And then the biggest one for me was just the recognition that single agency response is not working. And that doesn't matter whether it's the police, it doesn't matter whether it's social services or housing. You cannot solve all of those problems as a single agency. It just will not work. And then purposefully we put the budget right at the right-hand side, because I didn't want my colleagues to think that this was all just about the fact that we've got less money than we did 7 years ago, because these are the sorts of things that we want to be doing regardless of the budget we're given, because these things will deliver better outcomes for people. So that then leads to an operating model that we have developed for GMP, and I won't go through it in huge detail, but there's 5 strands to it. The first one is about place-based working. So we want to put as much resource at a local level as we possibly can. Working in a locality with all of those partners in an integrated way. And then the more rare the occurrence and the more specialist the nature, you raise it up either to a borough or city level, to a force level or a regional level. So that's at the heart of our operating model. So I have just suffered huge criticism and a 10,000 signature petition to the Mayor, because we are moving serious sexual offence investigation back to a borough level. And we're doing that so that they can work with the very people, whether they're voluntary sector or whether they're specialists from other agencies, at a local level where those issues are taking place. The middle strand that I will touch on is about the relationship with the public. And I talk in Greater Manchester that as citizens, as people who work there, who visit there, we have some fantastic rights, but with those rights comes responsibility. And I think too many people had forgotten their responsibility around being an active citizen, about supporting their local community, from the very small things right the way through to the very big things, which might be volunteering with us. So we're working very hard on what does that look like. Now, I wanted to call it a citizen's contract, but the feedback from the workshops with 3,000 people, they don't like the word contract because it's binding, and that's exactly what I wanted. I want them to be bound into working, of being an active citizen in Greater Manchester. The final one on the right-hand side is about technology, and it is about information sharing. It's about using mobile technology so that when professionals are working together at a locality level, they're able to share information and understand what is going on. So we've rolled out 9,000 mobile devices to all of our frontline staff. It's 9,000 because some have tablets to do statements and things. Most of them just have a mobile phone. And just whilst we're on that information sharing bit, I think it's really interesting, because if you ask the public, I think they think we share information to keep them safe. And I think they'd be horrified if they realised the level to which we don't do it. But when you put people together in a room to work on a shared problem in a locality, guess what they do? They share the information with each other. And you'll understand why in a second. So this is our local policing model. So whilst many around the country over the last 7 years have been retreating, centralising, moving back to a response model, we have been trying to very firmly hold the line about having neighbourhood policing still at the heart of what we do, but it very much being in an integrated way at a place level. I'll be honest, it's really, really hard. And the whole concept is that if we work in an integrated way, we do early intervention and problem solving, it reduces the demand and the necessity to respond. And it's a bit like chicken and egg. And it's becoming really hard to hold that line around the amount of stuff we're having to respond to and continuing to free up the time to do the problem solving. But that's our model. That's what we're working to. and we've actually increased the number of people that are working at a local level in Greater Manchester Police. So what does it look like in practice? Well, we started off with 2 sites, one in a lovely place called Platt Bridge in Wigan, and one in Hyde in Tameside. And they were housing association houses where we put in a team of professionals. If you can think of anything that touches on crime and disorder, they were in there. Antisocial behaviour coordinators, drug and alcohol workers, mental health, social workers, children's social workers, etc., etc., all working together with the local officer, the local PCSO, out of a housing association house in the heart of that community, and working on problems that fall just below the acute level. So it's not about an emergency response, it's not about those that are going into acute care in the health service. It's about those families, those individuals, those problems that are just about having a wobble, but are causing demand in all of our organisations. And it's about working on a shared solution to work with those individuals and those families to end their dependency on public service and allow them to lead a better life. We put in place an evaluation framework. We've worked with some private sector partners around that, and the professionals sat down and worked out what was their purpose, what was their joint purpose in their locality. It wasn't what the police's purpose was, it wasn't what health purpose was, it wasn't the local authority, it was a joint purpose for that locality, for those teams. I was hugely struck when I went and spent some time at Platt Bridge after it had been up and running really for about nine months. And it's stayed with me, this comment, because some really brilliant people said we all thought we were doing an exceptionally good job, but actually what we were doing is just referring people around the system and not actually making their lives better. And if that doesn't drive you to want to work in a different way and to want to do better for people, I don't know what does. The other thing that we did was we started to say, OK, so we're all here to keep a place safe 24/7. But actually, because it was an early adopter site, it was only working sort of Monday to Friday, 9 to 5. So we did a perfect week. So what does a perfect week look like in keeping people safe 24/7? And that drew out some real challenges, not least the one that was touched on by Adam about the fact that people go home on a Friday and the police don't. But from my perspective, having partners saying, you used to tell us that we all went home at 5 o'clock. Actually, it's 3 o'clock in on a Friday when we start referring stuff to the police. And we're starting to work through now what that actually looks like in terms of us all providing support to each other. And what I've said is, I'm quite happy to give up a few response cops if you're happy to put me some more mental health workers in, or some more social workers who actually know what they're doing and are trained to do it. So those levels of conversations are actually taking place. So this sort of just sets out for you a little bit about what it looks like. So 1 or 2 neighbourhoods in a locality, as I've said, about those frontline staff working together, being led by a local leader, and it doesn't matter, some of them now are police-led, some are housing-led, some are social service-led, but they all work to one manager at a locality base. We have used whole system thinking as the methodology to unpick everything. And they re-evaluate and re-challenge all of the barriers that throws up all of the time. And at the bottom, you can just sort of see one of these typical families, really, in terms of the amount of times that they knocked on an agency's door or they phoned 31 times, 15 times screened out or assessed, 13, nothing to do with us, refer, no further action. Actually, only in 8 cases there was action taken. And what we saw was that in 66% of the cases, actually, things were getting worse, not better. Again, that can't be right. What we've also done as part of those sites is very much work with the community and understand community assets. So they undertake an exercise of mapping what are the assets in a community and how can they help us to solve problems and work with each other. We've put some participatory budgeting into some of those areas around that. But what we found, certainly in Platt Bridge, was around 1/3 of the problems that community had, they were being able to be solved by community assets and not by professionals. So the community being at the heart of it is also really important. So, a little bit of a case study. Lisa and Dan. Dan was caught riding his quad bike on the field, something that happens all the time. We get numerous calls about kids on off-road motorbikes. So what would our normal response have been if we can catch the little devil? Well, on this case we got lucky. We could have given him a fixed penalty notice. We could have taken him home to mum and told him off. Probably what would have happened? He'd have carried on riding his motorbike, causing a nuisance, and not least probably injuring himself at some stage. But because that team were working together, and because they were sharing information, and because they had one purpose, which was to make life better for the people that lived in that community, they very quickly understand that Dan was only actually going to school 30% of the time. Well, that's going to impact on his life chances immediately, isn't it? In terms of work, he's unlikely to have a job and probably going to end up in a life of crime at some stage. Mum was just in a new relationship, and the new partner was a domestic abuse perpetrator. A previous partner was in prison for domestic abuse. Mum didn't have a job, and they were just about to be evicted from their house for the 3rd time in 3 years. Would a fixed penalty notice have helped? Absolutely not. There had been 40 referrals to different agencies over 4 years for that family. So the team were able to stop the eviction, work with the family, get Dan into school, got mum some voluntary work initially. Mum's now in paid work. Domestic abuse perpetrator partner has disappeared from the scene, and Dan is going to school around about 90% of the time. It's that sort of stuff that's making a real difference. So what does it mean? It doesn't just happen. It needs leadership and governance. It needs leadership from a locality base right the way through to chief officer level, and that's chief officer level in whichever agency that we're talking about. And that's why I thought it was important to set out how we're embedding this in the operating model for my organisation, so it becomes the norm, not just something that isn't a nice thing to do. We have a reform board across Greater Manchester that's chaired now by Andy Burnham, the Mayor. So that accountability is at a very high level, but it's also at a local level between the local police commander, local authority chief executive. It does require investment, not huge amounts of investment actually. It's required some private sector expertise around whole systems thinking, which we've brought in. I think we've spent about £200,000 just to work through with teams, give them the confidence, give them the tools and the techniques to be able to do the analysis. One of the biggest challenges that we face is that because those first 2 sites in Wigan and in Tameside went through all the problems and we all went, great, now we'll just roll it out, and everybody's going, but it's different here. Can't just roll it out in Salford because it's very different in Salford. So we're constantly having to push those boundaries and say, no, we've done the learning, we've done the evaluation, this works. And I think the big one for me is just those teams being able to sit down, review, assess and feed back what they're doing on a daily and a weekly basis to overcome some of those issues. I touched on the sharing of information. We do have something called GM Connect, so we are trying to do it at a GM level. We're very close to signing an information sharing agreement across the force area. We are putting in place technology which means that we will be able to not only push information to our partners but to receive it, to enable us to make better decisions. But I'll go back to the public think we're doing it to keep them safe, and we should be doing it. Okay.